If you are scheduled for an upcoming prolapse repair surgery, it is imperative that you tune in to learn these easy ways to minimize your postoperative pain and difficulty in recovery. My name is Dr. Brooke Kalisiak. I am a pelvic physical therapist who is passionate about helping people recover from pelvic surgery. And today I am going to go through some of the most common movements that people have to do in the early postpartum period that cause them pain and difficulty, and teach you ways that you can do it without either of those. Many people are very surprised to learn that common everyday movements like getting up and down from a chair, rolling over in bed, getting in and out of a car, or up and down from the toilet can become both painful and difficult to do in those early days to weeks after having major pelvic surgery. But there are things that people can do to make this less painful and less difficult. The key technique that I want you to kind of carry through all of these different suggestions I make is what I call belly, butt, and breathe. So it's called that because we're going to think about using our belly muscles, our buttocks muscles, and breathing when we do these movements. So how do we do that? The belly part, you want to think about pulling your belly in. So if I back up a little bit, pulling your belly muscles in like you're trying to give yourself a little hug with your tummy muscles. The butt squeeze, I want you to think about squeezing their butt cheeks like you're trying to pinch a penny between your butt cheeks. And the breathe part is blowing out. So now I'm going to take you through different common motions that people tend to have that pain and difficulty with post-operatively, and show you how to integrate belly, butt, and breathe along with some other tips to make these items easier and less painful. Going from sitting to standing is a motion that everyone does multiple times a day, even in that post-operative period. So we want to make sure that this is as comfortable as possible. So to make this task easier, when you're sitting down, you want to think about scooting forward to the front of the chair and tucking your feet back underneath the chair to give you a little bit of forward momentum when you get up. It's okay to push up on the arms, especially in those early days. You're going to feel like you need some help to kind of get up, maybe not necessarily all from the legs, so that's fine. Ahead of getting up is when we want to think about doing that belly, butt, and breathe that I just talked about. So you're sitting on the edge of the chair with your feet tucked under you. You're going to pull your belly in, you're going to squeeze your butt muscles, and you're going to blow out as you push to stand. Okay, this should help minimize the pressure through that surgical healing area and actually make it easier for you to get up. So that's a great way to help minimize those pressures and forces through that newly healing tissue. This same advice can be taken to getting in and out of the car, with one addition. Most people, when they get out of the car, think about kind of stepping out to the side and then maybe kind of turning their body and going. What I want you to try and do when you're sitting, say you're sitting in the passenger seat, I want you to think about trying to turn your whole body so you can get your feet on the ground outside of the car. That way you can use the car frame and the car door to help give you some support. And then we do the same thing where we do belly in, little bit of butt squeeze, and we blow out as we stand up out of the car. To reverse that, we want to kind of back up to that seat again and sit down sideways and then turn into the car. By kind of moving that way and not going sideways, that can minimize the stress and strain across the body as well. A third way to think about using the belly, button, breathe with sit to stand is when we get on and off the toilet. Now you're going to have to inspect your individual bathroom situation and check if there's anything that you can push up on to help you get up. Is there a countertop next to you? Is there grab bars in front of you? Do you already have some assistive devices in there? I do not recommend grabbing onto a towel bar because those are not meant to be grabbed and pulled on. They are not typically anchored into the wall very strong, so that is not a safe option. If you do need help getting up, pushing off your thighs themselves with your hands can be helpful. But same concept of belly, butt, and breathe, where we're going to pull our belly in, we're going to squeeze our butt muscles, and we're going to blow out as we stand up from the toilet. Bed mobility is another common area that people have issues with after surgery. So we're going to break it down into two parts. rolling over in bed and getting yourself up from laying down to a seated position. So rolling over, you can minimize the stress across the abdominal and pelvic area by shortening the lever arm. And what I mean by that is when we bend our knees up, that makes the legs a shorter lever arm, which puts less stress across the abdomen. So if you're laying down with your legs out straight, you want to one at a time bend them up, try and slide them up on the sheets so you don't have to lift the leg, so you're in that bent knee position. Once you're in that position, we want to think about doing what we call a log roll, and that's when we roll our shoulders and our hips over at the same time. We don't want to send one and then the other because that's going to strain across that abdominal area. So you're laying in bed on your back. You've one at a time bent your knees up. We're going to do belly button breathe again. We're going to pull our belly in. We're going to squeeze our butt muscles, and we're going to blow out as we roll our entire body over to the side. Okay? And this works whether we're going to the right or the left. And honestly, in the beginning, I recommend you break it up into smaller chunks. So I just talked about rolling from your back to your side. So if I'm laying on my right side and I want to go all the way over to my left side, I'm going to think about breaking it up into rolling from my right side to my back, and then from my back onto my left side, so that I make that into two different tasks versus one task to make it easier for myself. I do recommend rolling to your side before you get up from bed. If you're used to kind of throwing yourself straight forward out of bed, that is a lot of strain through the abdominal wall. And especially if you have abdominal incisions, that is going to be very painful. Or you can also feel a lot of pressure down through the pelvic area from that hurling forward motion. So you do want to be rolled to your side to get up from bed. And then once you're on your side, I like to think of it as kind of almost like a teeter-totter motion. So we don't want to push our upper body up and then let our lower body go down. That's going to strain across the pelvic area. We want to think about both of them coming up together. So get yourself situated where you can push up through your elbow underneath you, and it can use the other hand as well. And then you are going to let your legs come off at the same time that you push up through your arms and upper body here, so that we end up going all together like this. And of course, we're going to do belly button breathe with it. So a little bit of belly pull in, a little bit of butt squeeze, and you're going to blow out as you push to an upright position. Then you can sit on the side of the bed for a minute or two, kind of get your bearings, take a few deep breaths, especially if that did hurt a little bit. And then you're going to do belly button breathe again when you stand up from that seated position. So as you can see, I have said belly, butt, and breathe several times over, but we're really just trying to cue some of these deep core support muscles to kick in and give us support, and then using blowing out to help relieve pressure through that area so that we minimize that stress and strain across that healing surgical tissue. So not necessarily a daily task or something that we do multiple times a day. Well, some people might do this multiple times a day, but I want to talk to you a little bit about how to protect that abdominal and pelvic area, or at least make it feel more comfortable if you feel like a cough or a sneeze is coming on. So I recommend keeping in places where you commonly sit while you're recovering around the house. So typically bedroom, in the living room, family room situation, keep a pillow that you can hug across your abdomen here. So this kind of hug position, when you feel like a cough or sneeze coming on, can give you more support over this healing tissue, and that can feel much more comfortable than if we're just letting everything kind of hang out. So I recommend having that pillow close by so that you can quick grab it and hug it when you need to, if you have warning that a cough or a sneeze can come on, so that you have a simple way that you can support your abdomen when you cough or sneeze. So did it surprise you to learn that some of these seemingly simple movements were going to become difficult and potentially painful after your prolapse repair surgery? Which one of the tips that I gave you helped you out the most to make sure that you felt as comfortable as possible in your post-op recovery. I'd love to hear from you, so comment below. And if you need more help in your prolapse surgery recovery, I want you to check out more of our videos in our prolapse playlist, as well as if you are local here to the St. Louis, Missouri area, we would love to have you here in our pelvic physical therapy practice as a patient to help you optimize your post-op recovery. Thank you for watching our video. We hope you found it informative. We put out weekly content on pelvic health topics because we want people to be able to optimize their pelvic health throughout their lifetime. Make sure you like and subscribe our channel so that you're alerted when our next video becomes available.